This is the first Ways and Means hearing on sovereign tribal land in our committee's 235-year history. It's an honor to be able to make history in the chamber where this community exercises itself to self-governance. We are here in Arizona to strengthen our government-to-government relationship and affirm our commitment to help tribal communities prosper. Whether it's improving healthcare or making our economy more innovative, the policies we craft must include the voices and perspectives of Native Americans. I have the honor of representing Southern Missouri, which is one of the most rural areas in the entire country. It's a region filled with hardworking families who do right by their neighbors. It's also a region where many folks struggle to make ends meet. Though the experiences of rural communities and tribal communities are not the same, I see similarities between some of the broad challenges that they both face. Native American tribes face unfair, double standards in solving those challenges. The committee has been focused on policies aimed at strengthening tribal families, particularly in the areas of child welfare, adoption, and child support. Tribal child support agencies, unlike state agencies, are not allowed to garnish past due child support from tax refunds. As we heard at a committee hearing last fall, it makes it more difficult for parents to take care of their children. Tribes face unique challenges when it comes to administering federal child welfare programs. Native American children, constituting just 1% of the total child population in the United States, are disproportionately represented in foster care placements, accounting for 2.7% of placements. Collaboration between state agencies and tribes is necessary to ensure culturally appropriate interventions and placements within their communities to protect vulnerable children and keep families together whenever possible. One area that unites both rural and tribal communities is the healthcare crisis. There are simply not enough doctors or nurses or sites of service. As a result, rural Americans have a 43% higher mortality rate compared to Americans living in cities and suburbs. And Native Americans have a 33% higher mortality rate. Those are tragic facts that show more work needs to be done to solve this crisis. The committee is focused on working toward a future where every individual can access health care in the community where they live and where they work. Part of the challenge is getting more doctors to practice in rural and Native American communities. When doctors complete their residency in a rural community, they are 6 times more likely to set down roots in practice. This week, our committee voted to guarantee the recent Medicare-funded residency slots promised to rural hospitals are actually filled by truly rural hospitals. This is just a first step, and the committee will make further improvements to the graduate medical education program to secure the physician workforce for rural Americans. At the same time, we should look at how to help grow the healthcare workforce serving Native American communities as well. Patients also need open hospitals and quick emergency services in their area. Your congressman, Mr. David Schweikert has been a champion in Congress for preserving health care for every family. Just 2 days ago, the committee passed his bill that allows Medicare patients to continue to use telehealth and provides critical funding for small hospitals and emergency services across the country, including right here in the East Valley. Looking at the future, we must use every tool we have to end the healthcare crisis in underserved communities. For example, a competitive tax code will help businesses innovate and produce the next generation of life-saving drugs and medical products. Next year, the tax cuts passed under President Trump that fueled innovation and made American businesses more competitive will expire. We must find ways to build on the successes of those tax cuts. I want to thank the witnesses for taking time out of your busy schedules for being here today. We also want to hear from everyone in the audience as well. There will be clipboards that we will be passing out so that you can share with us any concerns or ideas. We will enter those comments and ideas into the official hearing record and take those back with us to Washington as we consider how to empower Native American and rural communities.